Hi, so today we are going to discuss about how much more you need to eat in pregnancy. A lot of people keep asking me, a lot of mother-in-laws and a lot of husbands are very worried. My wife is not eating enough. Is it okay? She's only doing this much. And I wanted to just kind of send it across that look, in pregnancy, you are responsible for your baby, but at the same time you don't need to eat for two people. Okay. How much more calories you need to increase depends on where you are starting the pregnancy from. For that, we will take BMI, that is the basal metabolic index, as that's a height weight ratio that your doctor can calculate on your first visit and tell you what is your BMI. In case she doesn't tell you, she forgets to do that, you can even ask or calculate yourself. There are a lot of BMI calculators on internet which are available, and these we should go according to, not strictly according to them, but then at least we know where we stand. Because if your BMI is in the normal range, for Indians it is less than 25. अगर आपका normal है तो one thing is for very sure that you don't need to eat for two people. First trimester, you can generally not increase your calories, whatever BMI you are. Whether you are a lean person, whether you are a big person, or you are a normal person, you don't need to increase your calories. Only I would say pay attention to the nutritional aspect and eat good food. Do not put empty calories in your stomach anytime in pregnancy. Second thing is, now what happens in the second or the third trimester? That will depend on where your BMI is. Like I just said, if you are a obese person, like that means definitely if your BMI is, when you started pregnancy, if your BMI was more than 30 BMI people need to increase their calories only say 200 to 300 kilocalories per day. Means one katori of dal, maybe an egg extra, maybe a little bit of salad extra in a day, right? So don't go overboard. It's difficult for me to keep telling you what food has how many calories, but 200 to 300 if your BMI is more than 30 kilocalories per kg body weight, per meter square. And if you are a normal person and if your BMI lies somewhere between 24 25, less than 27, then by and large you should take around 300 to 400 kilocalories extra per day, more over and above the normal diet that you were taking in the non-pregnant state. So this is another thing. And if you are a very thin person, your BMI is less than 22, then you should take around 500 kilocalories extra. This is not in lactation, this is only in the second or the third trimester of pregnancy. And in lactation, how much extra you need depends on how much are you lactating. अगर आप फुल फीड पे हैं तो बाय एंड लार्ज 500 किलो कैलोरीज एक्स्ट्रा आप मान सकते हैं. साथ में आपकी एक्स्ट्रा न्यूट्रिशनल रिक्वायरमेंट ऑफ micronutrients, your calciums and your vitamin D should be very important to ensure that your bones are not weakened when you are breastfeeding your baby. So अभी हम सिर्फ कैलोरीज की बात कर रहे हैं because people are very confused how much more food they need to eat in pregnancy. So if you are kind of limiting yourself and you are seeing that weight gain आपका कितना हो रहा है, my subsequent videos will tell you how much more weight gain you should have in pregnancy. बहुत ज़्यादा खाना खाने की ज़रूरत नहीं है प्रेगनेंसी में. Limit yourself, but please eat good food. If you include all colors in your diet, I keep telling all my patients that in case you are adding all colors, a red, a green, a yellow, as in fruits and vegetables, have a vibrant plate of food and you would not go wrong. You will get all your micronutrients if your colors are right. अगर आप बिल्कुल सफ़ेद खाना खाना चाहते हो, आप रोटी खाना चाहते हो, आप चावल खाना चाहते हो, आप चावल में चीनी डाल के खाना चाहते हो, दही डाल के, that's not wholesome nutrition. You're definitely going to be lacking in something. So उसमें आपकी कैलोरीज ज़्यादा करने से काम नहीं बनेगा. You need more micronutrients. You need more magnesium, your calcium, so it is very difficult for a normal person. You don't have time to really count आप कितना क्या खा रहे हो. So supplements तो ठीक है, whatever doctor is giving you, you take that. But अपनी तरफ से अगर आपने improvement करनी है, then you try and include colors and do not increase your calories to the extent that I told you. I will say it again quickly. If you are a normal weight person, First trimester you don't need to increase, and third trimester increase by 300 to 400. And if you're a big person, first trimester you don't need to increase, second and the third trimester you need to take little lesser, still 200 to 300 on an average, second and the third trimester. And if you're a lean person to begin with, first trimester you don't need to increase, second and the third trimester you can go around 500 calories extra even in the second and the third trimester. Okay, so that's as a broad guideline as to how to go about calorie calculation. That's all for now. Watch out this space for more. Bye bye.